Good morning and welcome. Today is December 8th, 2025. We are here gathered in the Larimer County Commissioners conference room, and we are gathered for a work session today with our Human Services Department. And this is regarding the state fiscal year 26-27 requested state budget and the impact on human services. I am Larimer County Commissioner Jody Shad McNally, Chair Pro Tem. Commissioner Stevens couldn't join us today. She's other engaged, and I'm also joined by my colleague, Commissioner John Kafalis. Also with us is our County Manager, Lorenda Volker. There are several other people at the table, which I'm going to let our Human Services Director, Heather O'Hare, introduce, but I'd like to take a moment, a privilege, to congratulate our amazing and outstanding, impactful, someone I hold in high regard, Heather O'Hare, who last week at our Colorado Counties Incorporated Winter Conference and meeting received Human Service Director of the Year out of all 64 counties and all the amazing Human Services Directors across the state who do tremendous work every day. Which makes even this recognition for Heather even more outstanding. I want to congratulate you and thank you for your work and your tireless efforts on behalf of the county, but mostly for all of those folks that we serve that need us to be their voice and work tireless for them, and along with your entire team. So I'm going to turn this over to you, but I want to just take a moment to say congratulations, well-deserved recognition, and we're so grateful that you work here in Larimer County.
Thank you, Commissioner. I have a great team that helps me look good every day, many of whom are here this morning. So like Commissioner Shattuck McNally said, I'm Heather O'Hare, the Human Services Director. Before we start, we'll do quick introductions. That way we can have more dialogue and discussion throughout the meeting without having to insert that along with it. So I'll start with Hannah.
Good morning, Hannah Ditzenberger, Policy Analyst for the department.
Good morning. I'm Tammy Promis. I'm the Administrative Coordinator for Aging and Adult Services, filling in for Kayleen today.
Good morning, Vanessa Fuel, Division Manager with Human Services.
Okay, so you all have a packet in front of you. And like you said, Commissioner Shattuck McNally, we're going to go through what's in the governor's proposed budget. I might go through the first 10 or so slides pretty quickly because I want to make sure that we have time to really focus on the last couple of slides that are not yet included in the publicly released budget, but the state departments are working on a revision that will be submitted in early January. So I want to make sure we have plenty of time for discussion and questions on those last couple of slides. But stop me as you have questions. If you want me to slow down, just let me know. So just a little bit of process. The process that the state departments go through to then work with the governor's office on the creation of the budget and submittal to then the legislature is a process that takes 10, 11 months. It is very cumbersome and has a lot of steps. But the budget is then released publicly. I think we received it on October 31st. And it includes the requested items or decision items, changes that they want to make for the departments that impact human services. So the State Department of Human Services, Healthcare Policy and Financing, the Department of Early Childhood, and then the Behavioral Health Administration. So I'm only focusing on those pieces. There are a lot of other items for other county departments, but we're just focusing on the human services specific ones. And there is a lot in this budget. I think this is the most impactful release of a proposed budget in certainly my almost 11 years with Larimer County. There are a lot of changes, a lot of requested both funding changes, but also systemic and policy changes that are included. And really because of two things. The revenue outlook for the state, and then the changes coming in the next 1 to 2 years from HR 1 that we presented on with you back in October. So those two, along with human services, historically being very underfunded across most of the programs. So those three things are all coming to a head in the next year, which is what's driving many of the requests that we'll walk through. So like I said, historically underfunded in really all of our programs. The ones we're going to focus on for the most part, and the ones that are really the focus of the governor's proposed budget, are the economic security programs. So Medicaid administration, food assistance or SNAP administration, temporary assistance for needy families, the child care assistance program, those programs that provide financial support to families living in poverty is really where we see the most significant area of focus. So as you'll recall, in 2022, we've had a lot of conversations about Senate Bill 22-235. It was a piece of legislation that attempted to do two things. One, identify best practices in how counties administer the economic security programs, and then create a funding model to quantify the level of underfunding that counties experience. So there was a very lengthy report that was released, I think, in early 2023. And what that showed was that county administration at that time for these programs was about $50 million underfunded. So as you can imagine, in the 2 years since then, that number has only grown. And there's very little from that state report that was ever implemented in best practices or really in making a lot of significant progress towards the funding that counties need for these programs. So that's just context to current state. And then I won't go through all of these because we've spent, I think, 2 work sessions with you in just the last 6 weeks or so going through these in detail. But I do have our presentation from our work session in October that's linked later in the presentation, so that if anyone that's listening has not seen that, there's a hyperlink in the presentation so they can find it. But significant changes coming to food assistance and Medicaid in the next 2 years, some of which are already, we're already required to implement around work requirements for food assistance. And then the piece that you'll see a thread throughout the governor's budget is the fiscal sanctions that might come with error rates, determining eligibility inaccurately for food assistance or Medicaid. That will have a significant financial impact on top of the already underfunded system. Okay. So before we get into those, I'm going to cover the other requests that are in the budget for other programs, and then, like I said, spend as much time the second half or so of the meeting so we can really dig into what we understand about the economic security. So with the early childhood services, so for us, the largest impact is the child care assistance program. The state is requesting to make cuts to other programs that they fund with the federal funding that can also go towards the child care assistance program. So it's called the CCDF fund, is what the block grant is called at the federal level. And it is Child Care Development Fund is what CCDF stands for. So there are a variety of activities that they can fund out of the CCDF funding. So they want to reduce the other activities to try to prioritize those federal funds towards the child care assistance program. So those other activities really are focused on quality initiatives. So helping to support providers in increasing their quality towards their licensure. Other smaller, it's not insignificant, but it is a much smaller dollar amount that goes towards those quality initiatives because it is capped at the federal level, how much each state can use towards those activities. And so they want to strategically reduce those investments over the next couple of years to prioritize more funding going into the child care assistance program.
Question, please.
Commissioner Kafalis.
Yes, thank you, Madam Chair. Thank you, Heather. Would you further clarify, my understanding is that the Child Care Development Fund, there are two, there's discretionary funding from the feds, and then there's mandatory or required funding. Which bucket are we talking about? And related to that, have there been, perhaps by a miracle, any increases in the Child Care Development Fund block grants? But I think there are two funds, I believe.
Yes, so there are two, so the mandatory spending is on the Child Care Assistance Program, the direct services. But there is also a percentage that they have to spend, and I can get the percentage for you. I want to say it's 10% of the total block grant. They have to spend towards those discretionary activities. So they are slowly moving the spending from those discretionary activities over to the mandatory. So again, to prioritize the direct spending in CCAP. There has not been an increase in federal funding, but there was an increase that the Joint Budget Committee appropriated last year for state fiscal year 24-25. They provided one time a supplemental of $15 million that went to counties. So it actually covered the overspending of all counties. There are close to 25 or 26 counties that are on a freeze or a wait list. So the one-time funding last year covered all of that overspending. And then for this current state fiscal year and moving forward, there was an increase of 10 million each year. But that came from the State Department's reserves. That's how they funded that. It is not an increase in federal funding. So that's also what the intent is of reducing some of these quality initiatives, is also to stabilize the reserves, because they know they will run out of reserves in the next couple of years because of the increase in spending in CCAP.
Thank you for clarifying that. Can you go back and, I just want to make sure I'm clear on this. You talked, it's reducing the quality initiatives to stabilize the reserves, and I want to make sure I have this right, and then move some of the money from the discretionary over to the mandatory buckets to focus on I'm trying to figure out, I need that extra little word, because I'm writing furiously here like we did the last time, so.
So let's say that they receive $100 million. It's more than that, but just for simplicity, they have $100 million that they get from the feds. The counties are required to contribute 11% in a match. So that then increases it a little bit more. They have a certain amount of flexibility in the discretionary activities. So they spend it on training, quality initiatives for providers, so that there is a good pool of providers then that will provide the direct services. So it's a provider support is really what those activities could be oversimplified as. So they are slowly reducing their spending in that area to move the money over to the direct services in the CCAP.
Thank you for, that was my understanding, so thank you for clarifying that. I appreciate that. Thank you.
So just really quick, I know the question always comes up as we're talking with you all and with other community partners. We are still on a freeze. We don't anticipate changing that. We should have updated fiscal data from the State Department by this Friday to see where we're trending for this current state fiscal year. And then we meet every month to review it and review it in comparison to our expenditures. So if something changes where we are seeing a greater reduction in expenditures, then we would let you know if we intend to switch back to a wait list. But unfortunately, it does not look like that is the case. We have come within budget. So that is unfortunately, the good news. We have seen a reduction in the number of children we're serving by close to 50%. So we have come within budget, but we don't have the flexibility in the budget to add more families to the program. And don't anticipate, unfortunately, that we will for some time. Okay, switching to child welfare. So there are 4 different reductions that the governor's budget is proposing in the child welfare services. The Tony Grampsis Youth Services Grant is a grant program that provides funding out to community-based organizations that do prevention and intervention services across the state. So they are proposing a reduction in that grant program. They also have proposed reductions in the collaborative management program. So for us, that funding has significantly decreased in the last several years. But that's the funding that we use to identify innovative services and help get further upstream with prevention and intervention through LCIOG, Larimer County Interagency Oversight Group. So a further reduction in the collaborative management program will likely decrease the budget that we have for that area. And then they're also proposing reductions in the state level support to foster and adoptive parent recruitment and training, and then also reductions to the statewide hotline that receives child welfare calls. Those last two, the foster parent and adoptive parent recruitment and training, and then also the funding for the state hotline, they are proposing a reduction in their budget down to their actual spending. So those 2 line items have been pretty underspent for the last couple of years. And so we don't anticipate a significant impact in those last 2 because it is just a budget reduction to get closer to where they're spending.
So if they're reducing down to where they're actually spending, is that a glimmer of hope that maybe they're reducing the amount of calls or response time? Or if they're actually reducing to the actual spending, does that mean maybe the level of services staying the same, or am I just hoping for that?
So it won't impact the level of service. So this is the state team that staffs the hotline, and it is 24/7. So they have to respond to the calls as they come in. There is not really any flexibility in the response time. They've upgraded technology and they've done some process changes. So they've been holding on to vacancies as they've worked through those pieces. And so they don't need the staff because of those technology and process enhancements. So they are identifying that they don't need then the funding to go along with that. So we shouldn't see a change in the service level.
Okay, that's good news. Thank you.
Changes to Medicaid. So the governor's budget, you all have likely seen, there's been a lot of media coverage over the last several weeks. The Medicaid spending is one of the primary drivers of the state's budget deficit. They are the largest spender of all of the programs at the state level. So the governor's budget proposes cuts close to $530 million to Medicaid spending. And the bullets that are listed here under the key changes section is the area where they will make those cuts. So we have had continuous coverage for children 0 to 3. That was actually a waiver that we had approved from federal partners that is going away. And then other cuts they're trying to, I think I heard a commissioner last week at the conference refer to it as using a scalpel instead of a shotgun. To reduce Medicaid spending, but it will still have very impactful cuts. So $530 million in spending to the entire system will impact areas of our child welfare practice, could also impact areas of our aging and adult services practice where we have strategically leveraged Medicaid funding to increase the services at the local level. So we'll be watching it really closely. Those budgets are also very concerning, and so we don't want it to be really just a cost shift. So we'll be watching it, and we have those conversations with the various state departments. But we will see a reduction in service level for Larimer County, but also across the state when we're talking about cuts of $500 million.
And Heather, I remember that, that quote during the meetings as I sat in those meetings with some of you. I just sat there and tried to absorb instead of taking many notes because I knew we had this meeting today. But yeah, that was one of the more impactful. And the other Medicaid presentation from the Eastern Plains was very impactful. And I think some of those things, I think that's where it was at actually. So I appreciate you sharing some of those insights. So thank you.
Question, please.
Commissioner Kofalis.
Yes, thank you. So the $530 million proposed cut to Medicaid, that's for state fiscal year 2027? It starts that's for one fiscal year.
Yes.
And what percentage of the overall budget is the Medicaid budget? That's a pretty sizable chunk from our Medicaid budget.
We'll confirm, I believe it's 25%, but we'll double check. It is a sizable reduction.
For one year.
for 1
This
year.
is the fiscal year starting July 1 of next year.
Yes, so they, based on the revenue outlook for 26-27, so July 1st of 26 through June 30th of 27, the Joint Budget Committee has to reduce spending by $1 billion. They then anticipate in 27-28 having to make another reduction of $1 billion. So this is just for the 26-27 year, but we have been told by all of the state departments we work with that we should anticipate probably the same magnitude of cuts in 27-28.
Thank you.
Yes, but we'll double check the scale in relation to the total. It is significant. Yes. The direct piece that we will also see, which is actually starting a little bit earlier, so in 25-26 and then again in 26-27, when we talk about Medicaid cuts, we also see cuts to our county administrative funding to administer Medicaid eligibility. In statute, we are defined as a provider, much like a direct service Medicaid provider. Counties are also defined as providers. So when they talk about provider rate cuts, that also then impacts our administrative funding. So we have been told that the special session that happened over the summer, they made cuts of pulling back the 1.6 provider rate increase. So we will see a 1.6% decrease in this current state fiscal year. And then part of the $530 million reduction will also include other provider decreases. We don't know how much. That'll be the discussion of the Joint Budget Committee. So that is a direct impact to funding that the county receives in addition to the other service funding that the community receives. Okay. So there is a lot in the budget related to temporary assistance for needy families. R5, and we've included here this table that goes through these 5 options and specifically the impact for Larimer County, so that you have it. But R5 from the Department of Human Services puts forward 5 different components in reducing the temporary assistance for needy families budget. So there's 2 pieces to this. They've also since released that they want temporary assistance to needy families to be restructured under what they're calling the districting model. So I'll put a pin in that and come back to that. But Works Allocation Committee that Commissioner Stevens is a voting member of met last week and actually voted to oppose all but number 2 while we continue to work on more impactful strategies. So all 5 of these are included in the governor's budget. I would say none of the 5 actually stabilize the budget and the funding for this program because of House Bill 22-1259 that put this this program on the fast track to running out of money. And that's really what we are experiencing now. So that's why in House Bill 1259, number 2 is a direct result of that legislative change. And so the Works Allocation Committee, or the WAC, is sending a letter to the Joint Budget Committee, I believe today, to oppose all of these except for pausing the basic cash assistance cost of living increases that happen each year. They would pause it for 2 years, and then after 2 years, make it subject to additional appropriations from the Joint Budget Committee and the approval of those rules through the state board. So that, it really is a Band-Aid fix while we try to figure out what is the financial sustainability of this program. That, again, the state has now proposed that it's the districting model that they think will help alleviate some of the pressure. So I'll get to that in just a second because it's TANF along with several other programs.
So I'm going to ask this question, but maybe I want to ask it so I don't forget it, but maybe put that in the parking lot for when you go to that. But when I look at this and I think about the districting, in my mind is cascading or accumulating impacts that maybe are not understood of the consequences or even unintended consequences. Not to giggle at that, but I mean, we talk about that a lot, but there's a lot of unknowns and uncertainty that introduce when you have just this and add these other things. So I don't need to answer it now, but I just want to kind of hope that maybe you're going to talk about that because it seems like there's a lot of disruption and change in a system very quickly that I'm very, this has really been bouncing around my brain since we started talking about this last 2 weeks and then listening to the conference. So I'm glad we're having this work session today. Thanks.
Yes, I will come back to that for sure. So there is a lot of detail here. Vanessa's done a fantastic job of outlining the impact on Larimer County, so I'm not going to go through it in detail because I really want to make sure we have time for the districting conversation. And I should have shared this in the beginning. We did a town hall with all of our staff on Friday. So what we're talking about, they are aware of. We've shared with them what we do know, what we don't know. So they are aware that these conversations are happening, which is incredibly important to me that they hear it from us first and not from another county or in a different venue from someone else. So, okay. So there are several additional budget requests related to food assistance and Medicaid that go along with the districting proposal. So I'll go through these quickly. The Healthy School Meals for All was passed by the voters in November that allows for some of that funding to help support food assistance. So the governor's budget includes one request for the 26-27 year and then a placeholder for 27-28 to help backfill the loss of federal funding that is going into effect immediately as the federal program reduces the federal support in the administrative category from 50% to 25%. So Colorado has to figure out how to now cover the cost to administer food assistance for 75% of the program, whereas before it was a 50-50 split.
When did that take effect?
So it is going into effect in the next year,
In October of next year?
October 1st of 2026.
The start of the federal fiscal year, that's right.
So the governor's budget requests an additional $37 million from the Healthy School Meals for All funding in 26-27. And then that increases because the revenue from that ballot initiative will also increase in future years. So that increases to almost 49 million in 27, 28. So again, it's a partial backfill. It does not cover the entire loss of the administrative funding, but it is significant. Without that funding, we would have to continue to absorb the cost with the workload increasing, because we are required to process applications and the recertifications as they come to us. There is really nothing we can do to reduce that. We have to process that work as it comes in the door, with very little flexibility. So that's the increase that's requested for food assistance. So this is where it gets a little confusing. In the governor's budget, there is also a request from Healthcare Policy and Financing for what's called centralized services. So this is parallel to the districting conversation. So R7 from Healthcare Policy and Financing looks to centralize these 4 tasks that are currently the responsibility of counties, but they want to centralize them at the state level to create capacity or efficiencies at the county level. So what Healthcare Policy and Financing has said is that by removing these 4 responsibilities from counties, they want to maintain our funding as is, and so they believe this will create some capacity in our staffing and resources to be able to handle the additional workload that we've talked about that's coming to us from HR1. That is,
Can you state that one more time?
so by removing these 4 things, so we have a call center today that handles all calls that comes to Vanessa's team related to the economic security or public benefit programs. They want to centralize the what they're calling tier 1 calls. So the most urgent calls, they want to come into the state at a state level call center first, and then they would transfer calls to Larimer County for Larimer County residents that state team can't answer. Similar to fraud investigations, so there is a lot of changes coming to Medicaid fraud. So they want to centralize fraud investigations for Medicaid at the state level. Document scanning and quality assurance. So those are the 4 areas. They believe if they remove those duties from counties, the governor's budget requests to keep our funding flat. So they'll remove these duties from us, and then we'll be able to handle the new work that's coming to us from HR1 within existing resources, within the capacity that would build in our budget. I don't know that it will add capacity, honestly. And they are talking about doing 2 of these for work that is specific to SNAP and Medicaid, and then the other 2 would only be Medicaid focused. So we have asked a lot of questions about that to make sure that we are doing this in a very logical way, so that if they're going to pull fraud investigations only for Medicaid, then we would ask that they pull fraud investigations for SNAP. We don't need a state investigator reaching out to a household with concerns about Medicaid, and then an investigator reaching out from Larimer County with concerns about SNAP or another program. So we have weekly meetings talking about this and really trying to understand what's the intent and then put alternative solutions on the table. The other piece that I'll connect with Lorenda, but we pretty quickly need to start discussing. They want to centralize these 4 tasks at the state level, but they want a county to contract with the state to do the work. So the Tier 1 call center, as an example, their request in the governor's budget identifies they believe they need 260 staff to handle all of the calls that come in. They want a county to bid for that contract and actually administer that call center from a county, not from the state level. And they intend on having that bidding process open in February. So we are trying to get a lot of the detail to then determine if we would come to you and recommend that we bid for any one of those components. But it is something that they are asking counties to explore pretty quickly. They want this to be implemented July 1st of next year. So there's a lot of technology enhancements and other pieces that would go along with that. But let's say that we bid for the call center, just using that as an example. We would then have those staff, Larimer County staff, but we would be answering calls statewide for all counties through a separate contract than the rest of our administrative programs.
Please.
Commissioner Kofales.
Thank you. Are we looking at potentially 250 plus 50 plus 33 new FTEs? And if so, where is that money coming from? And will they be state employees or would they be county employees?
So I guess any one county could bid for all four, the likelihood of getting all four contracts. So each one of these bullets will have a separate state contract. So it's up to the county to determine if they want to bid for one or none or all. But so it would be a state contract to pay the county for county employees to do this work. So let's say that that we were to become the call center, it would be standing up a new program for us. We have a call center in technology. We have a fantastic call center and really great processes that we implemented actually with some ARPA funding from healthcare policy and financing in the last couple of years. But this would be basically replicating that duty for a separate program that would be ready to take all of the calls statewide.
And would that mean hiring new people?
Yes,
And where would that money come from?
from the contract. It would be entirely funded from healthcare policy and financing.
From their budget?
From their budget.
And those employees and this, if implemented, this would have to be up and running July 1st, the call center with 200 employees trained and ready to go.
I don't know, so they'll scale the staffing.
Okay.
The implementation detail, we don't yet have, but they do want to start July 1st. The money would start July 1st.
Okay.
There's pros and cons, for sure. So more conversation to be had, I think, once we have more detail.
I'm good, thanks.
So that is happening parallel to now the State Department's proposing that we restructure the system entirely. And so that's what I have been referring to as the district model. They're calling it districting because in statute, there's already language about counties being called districts. So the ability to restructure is already in statute. There is a whole lot more statutory change that would be needed. But what they want to do is put us into more of a regional model. So they announced this Friday, the 21st of November, at 3:30 in the afternoon before the Thanksgiving holiday, with absolutely no notice to counties. Our Directors Association reached out 30 minutes prior to ask what this last minute meeting was about, and they were told they can't share, just join and we'll share all of the details then. So that is very frustrating and disheartening because then we also learned that they've been working on this for 6 to 10 months behind the scenes, researching other states that have a similar model, researching what they believe the benefits to be. And I think there are a lot of questions still remaining, both fiscal questions, legal questions, process and technology questions that they don't have answers to. So after that announcement, there was a lot of conversation last week at the Commissioners' Conference, and they have pulled together a small advisory group with the necessary representatives from the 2 state departments, and then there are 8 county representatives. So I am one of those county representatives, and then the president of the Colorado Human Services Directors Association, and we have a regional structure, so each region then has a human services director as part of this group. And they are offering 3 different meetings to basically put all of the implementation and logistical detail to this plan. We had our last meeting last Thursday, the next one is this Thursday, and then we have one more next Tuesday. Because they intend to, the deadline to submit a budget supplemental is December 24th. So they need to build all of this out by December 24th to then get it to the Joint Budget Committee as part of the supplemental process in January. And they want this to be phased in starting as early as next July. So the programs that they are talking about, this is a really crucial distinction. There are some programs that they are talking about districting under this model and some programs that they are not talking about including. They would include Medicaid, food assistance, CHP Plus, Children's Health Plan Plus under Medicaid, temporary assistance for needy families, adult financial and old age pension. So that 4th bullet down lists the programs that are included. What they are not including is CCAP, Child Care Assistance Program, Adult Protective Services, Child Welfare, Child Support Services, and then for us, we also have the Office on Aging as the AAA. That is not included. So that's really important because when we think about the impact of this to small and medium counties, they have staff that do multiple, one person who does multiple things. So the impact to small and medium counties looks different if they have the same person doing, let's say, adult protection and child welfare. So they are proposing 11 districts or 11 regions, if you will. They provided a map to us last Thursday. And Hannah has been fantastic. She's helping to keep us coordinated and organized within the Directors Association. She's created a update document similar to our federal tracker that we created to try to stay on top of all of the communication and the decisions that are being made. So Hannah created a survey that was sent out on Friday to all county directors of human services to get their feedback on that map. The piece that is really important is that second to last bullet that I've highlighted in yellow. It has been communicated to us, and I think it's been communicated to Colorado Counties, Inc., CCI, as your association, that this is not negotiable. The plan is to district counties to create some regional structure. How we do that and when we do that is up for discussion, but the plan is to move forward with a regional model in the next year to find efficiencies, to try to stretch the existing resources and dollars further, but then also to stabilize these programs as there are significantly more federal funding cuts to come. And they have been researching Wisconsin, Ohio, North Carolina, and North Dakota, where they already have a regional structure for these programs. So to your question earlier, Commissioner Shattuck McNally, the consequences of doing this. This is what I've shared with staff, what I've shared with my peers and the state departments. I struggle with a couple of things. The impact for us is different because in one, we are a large county. And so when you have, and even though our financial constraints are the same as they are for all counties, our allocation and the funding we get from the feds and the state is a lot more than small and medium counties, which then helps us to have a different infrastructure as we use those resources. So we are also significantly underfunded and struggle to meet the requirements with our funding that we have today. Being so involved in the legislative process for counties over the last 10 years. I also struggle with counties continuing to say, we are underfunded by $50 million and just hope that the Joint Budget Committee finds $50 million somewhere. They've struggled to do it up to this point, and what is coming from HR1 is hundreds of millions of dollars. So I don't see a light at the end of the tunnel that there will magically be funding that is going to be able to cover counties to keep the structure the same way it is today. We have to do something different. And I think we, Larimer County and many other counties that we partner with, are very innovative and very efficient. So I wish that they would have asked us a lot sooner. And at the same time, I'm grateful that we have several weeks to help figure out the details, so that it can find the efficiencies and find more leeway in county budgets, because I don't believe that either state department has that expertise at all. When we're asking questions about county funding and the legal parameters, they can't answer those questions for us. So we have to be at the table to help define what this looks like. And counties partner really well with each other, that I think we could make this work to help stabilize the funding and the services, but we have to be the ones at the table to be talking about the consequences and the impacts to counties, rather than the state guessing at what they might be.
Appreciate that answer very much, especially with the bullet point of that this proposal is not negotiable. So I guess we, you all, and we support you as we pivot and try to do what we can. So I appreciate that answer very much. I've been thinking about a lot about that. So it seems like, I like what you said about something has to give. I mean, because it's not changing, we have to do something. So I appreciate that. Commissioner Kowalski, do you want to add anything?
Well, I think I mentioned this to you, Heather, that at Friday's State Board of Human Services, there was a fairly extensive departmental update, and there was mention that, what you just shared about non-negotiable, that was also brought up at State Board. And
I would-
forgive me, and Commissioner Pogue made a good point. There was good questions, good pushback, that we need to figure out how we can be more efficient, how we can address error rates and everything else, but we mustn't lose sight of why we're doing this, and that is to serve people, to try to help them overcome barriers and have more economic security. Mustn't lose sight of that.
Yes, that has to be, I think, the North Star that we're working towards. So I say that it's not negotiable. That's from the State Department's and the Governor's office, that this isn't negotiable. They can't do this without significant legislative change. So it will be up to the legislative process, both in terms of budget, but also significant statutory change on how some of these pieces work. Our county attorney is actually in a meeting right now with the county attorney work group, talking through the legal logistics of it. We've pulled together a fiscal subject matter expertise work group that Ann Smith from our department, thankfully, she is not retiring until February, because we will have to really leverage her fiscal expertise. And then we have a lot of work happening to make sure that directors are coordinated and organized with each other. And then CCI is also figuring out how to organize to decide from the county perspective what's not negotiable, right? We haven't yet figured out, I think, this is such a shift structurally and systemically that I think it's taking people a long time to sort of wrap their head around what are the details and what are the pieces that aren't negotiable from the county perspective. And the customer service and access to these programs is the first one I would say is not negotiable. How that looks, and I think we've made a lot of innovations and changed. I mean, I'm still hearing from my peers that staff aren't allowed to work remote, right? That we've changed a lot in our structure and in our processing over the last 5 years, that I think are tremendous success too. We've had staff that have been helping with overtime for other counties 6-7 hours away. So there are elements that I think are a little bit more negotiable from my perspective than maybe some of my peers, because we are innovative and we use technology, and we find different ways to meet the needs of the person trying to access the services. So I'm trying to elevate that too in the small working group meetings, but also with my peers to think outside the box, because living within the underfunded, highly fiscally constrained box is no longer an option.
So I see this list up here, and I was trying to picture this in my head. I see that the regions, and I see a variety of, I see 2 large counties, but a lot of small counties.
Yes.
Is that intentional?
Yes, so the regional reps, so these are the regions we have for our Human Services Directors Association. Pueblo County is technically part of, there are a couple of counties that actually saddle a couple of different regions. And so that was intentional. The Southwest region and the Southeast region are large counties. That's who that region picked. So we really left it up to the region to identify who was the best to advocate on their behalf, and then made sure that it was a mix of small, medium, and large. And then Deb Rettenberg, who is the director for Grand and Jackson counties, will become the president of the association next year. So it was important for that continuity that she was also included from the statewide perspective. And they're all raising very different things. When we saw the map last week, for the 11 regions that the state has identified the map for, so that's a really important piece to say again. 8 of the 11, I think, were identified to be led by a large county. How that looks and how the relationship between those counties in that region looks can vary, and the logistics of how it happens, but most of the regions do have a large county sort of as the hub for that area, which has pros and cons too.
Okay, so we're about out of time. So I'm wondering, is this your last slide? I see you had inserted the slide with the additional resources. I
Just the
appreciate that.
links, yes, to different documents that are helpful for more context. So we have 2 more meetings around the advisory group for the districting. We will keep you updated and make sure that you have information as it changes. And then what gets submitted in January, I think, will be very telling in terms of what the next steps are.
And when you say updated, is that kind of how you kept us updated during the SNAP freeze and all
Yes.
those changes? Okay, that was really helpful, so I want to thank you for that. I'm going to let Lorenda have a couple words and come back to you, Commissioner. Lorenda, do you want to add anything? I'm sure that your mind is churning like mine.
I think these kind of meetings are really important. So the more we can do, so the public hears as well as the board, kind of what the current status is going to be really important as we go forward, whatever the process ends up being. These slides are really helpful. It's great that they have the links in them. I think continue that part of the process. There aren't too many of them. It's easy to follow. And then we have these recorded meetings that folks can follow if they need to. So I think thank you for that. Keep talking to us. I know nothing has been decided yet, so there isn't really anywhere to go, but I appreciate that you're monitoring it so closely and that you and I are in such close contact.
And thank you for being on this task force or whatever they're calling it. So I appreciate your above and beyond service there, but I think it's absolutely critical right now. So thank you. Commissioner Kofalis.
Well, just, of course, thank you for all of putting all of this together for the surveys. I'd be interested to get feedback on what the counties around the state think regarding the map, the proposed map. I'd be interested to know what the methodology was, if any, to determine those, those regions, those 11 regions. I mean, there's a lot of questions still. So just to say thank you, but also wondering, Heather, team, what do you see as, I mean, how can we be supportive? What might be some of the next steps, follow-up steps, coming from the electeds, from the commissioners? I know there's a CCI steering committee meeting on the 12th. Any thoughts on how we can be supportive and what is the appropriate follow-up and all of that?
Great question. So the regions were chosen by performance, spending, and then a couple of other factors. So the leaders of those regions that they've selected are high-performing counties. That was first and foremost. And then looking at the resources that those counties receive to be able to do the work is another really significant piece. So this Friday, both of the executive directors for the state departments are coming to the CCI steering committee meeting for, I believe, an hour to hear what additional questions and concerns there are from commissioners. So I think your leadership on the State Board of Human Services is really crucial. As you all see the rules that come forward, we intend, Hannah and I will also have some snippet of this available for the legislative luncheon next week. So you'll receive another packet, and happy to hear how much detail you think would be helpful. But we will make sure that you have the updated information and then what remaining questions are still unanswered from the directors, and happy to sort of guide you as you all are in different venues with the state departments for different purposes.
And actually, if I may, Madam Chair, just one additional quick question, I think. How informed are our state legislators about what is happening, especially the local folks?
Very little, if any.
So that's something to think about.
Actually, I saw several of them last week, and I asked them this question, and they didn't seem to have any indication of any of this, so I was quite surprised, so.
The Joint Budget Committee is doing all of their briefings now, and they also have no awareness of this at all. They will receive it, I believe, on Friday.
Well, I know we're at 11, but I would recommend that whatever information we're going to discuss at the December 18th legislative meeting, we may want to provide that sooner to the legislators sooner than later, so they're not totally surprised. And I think that would be conducive to a more constructive conversation if they have a little time to read the material,
Yes,
whatever we might send them.
we can do that.
Thank you. That's all I have.
Thank you, and I appreciate all this information. I'm sure we'll have more questions, but we are at time, and I want to just thank you all. Tremendously grateful for your expertise and your just true diligence to the work. And let us know, and staff know, Lorinda, Lori, and Laura, how we can support you. And thank you. So at 11 o'clock, we are adjourned. Thank you.
Thank you.